Hello, good morning everyone. My name is Dr. Ailara and welcome to yet another episode of my videos. Now in today's video we are going to be talking about menstrual pain, what some people refer to as period pain. In medicine we actually call it dysmenorrhea. Dysmenorrhea is the umbrella term for menstrual pain. Now, I'm not a woman, but I've had a couple of patients in my lifetime, and I have a mother, I have a sister, and I have friends. And most times when they call you, it's because they're having some form of pain in their lower abdomen. So now, that's why I decided to talk about this. And then the past week, I had a woman that came to the hospital around 1 a.m. mostly because she just had normal menstrual pain. So I decided this was an interesting and important topic to talk about, and so here we are today. So let's jump straight in. Menstrual pain is that crampy feeling or that crampy pain that women experience in their lower abdomen whenever they are on their period. That pain can be categorized into two. We can have what we call the primary menstrual pain, and we can have what we call the secondary menstrual pain. Primary menstrual pain is that quote-unquote normal menstrual pain that women experience. It's normal because we believe that there is no underlying cause. While secondary menstrual pain is that quote-unquote abnormal menstrual pain that women have, because it's called it abnormal because we believe that there's an underlying cause, an underlying pathology, underlying problem in their pelvis that's making them have this pain. Most women in their teens and 20s will experience primary menstrual pain, while women in their 20s and 30s and 40s will experience secondary menstrual pain. Now, that being said, I'm not saying that every woman that is in their 30s and 40s that's experiencing menstrual pain is having secondary menstrual pain. No, but this is just a matter of proportions so that we can rationalize the concept. Okay, there's a lot more to what determines what is secondary and what is primary, and we're going to see that in this video. So now that we are done with the introductions of what is primary and what is secondary, let's move on into what the symptoms are. Again, the symptoms will be divided into primary and secondary symptoms. So primary symptoms, what's the symptoms that you will see? If you see them, you will think, oh, this my menstrual pain is primary. I don't have any underlying disease or problem that is causing me to have this menstrual pain. I'm cool, okay? Or you can reassure yourself. So if the pain is mild to moderate and you can bear it, it's most likely primary. That's one. Primary menstrual pain also tends to start at the moment that you start to see your menses, or at max 1 day before. So it starts at the moment you start to see your menses, or at max 1 day before. It is mild to moderate, okay, and it doesn't inhibit your daily activities. That being said, 1 in 10 women that have primary menstrual pain will have problems. The pain will be so much that it will inhibit their daily activities. Okay, so you have to put that clause in there. Another thing about primary menstrual pain is that you may experience other features apart from the crampy abdominal pain that you have. You may feel like vomiting. Some women even vomit. You may have diarrhea. You may feel bloated. You may have headache. You may feel tired. You may feel faint. You may be emotionally labor, which means you just for some reason you are probably just angry at everybody, or for some reason you just start to cry. Okay, those are the things that women experience, women that have primary dysmenorrhea experience. However, women that have secondary dysmenorrhea have similar symptoms to primary dysmenorrhea. However, there are differences. The woman that has secondary dysmenorrhea, the pain is always severe. It is always down. Every month, whenever the pain is coming, she's scared. Whenever the menses is coming, she's scared to death because she knows, man, it's about to get real. Okay, and then the pain typically starts sometimes 2, 3, 4 days ahead of her period, and then it will last throughout the entirety of her period. So it starts 2 to 3 days, 4 days before she sees her menses, and then it lasts throughout the menses. Unlike in primary dysmenorrhea, where the pain typically starts the day she starts to see her period, and then lasts for max 2 to 3 days into the period. In secondary, that means the one in which you have an underlying cause, the pain starts 3, 4 days ahead of the period. It lasts throughout the period and it is severe. It incapacitates the woman. She can't do nothing. She can't have fun. She can't be cool. She's extremely irritable. and that's when you know somebody most likely has secondary menstrual pain. Other features are features that will tell you or give you signs that okay, there's an underlying problem. Okay, so the woman will have an associated heavy menses. The menses may be very heavy. She'll be seeing these dark blood clots inside the menses. That's one. Two, when that period ends, before she sees another period, she may also spot or see some bleeding in between her periods. That's two. Some women that have this secondary menstrual pain, whenever they have sex, it's painful. It's painful, especially on deep penetration. It's painful. Okay, these are the signs and these are the tells. And then apart from that, once this period ends and then she's supposed to see another period, in between the periods or in between her periods, she may also have this pain, severe pains. So you will know, the picture will typically tell, oh, there's probably something going on here. And those are the symptoms of secondary dysmenorrhea. Okay. So what are the causes? What are the things that cause primary dysmenorrhea? Let's start with primary dysmenorrhea. What are the causes? Well, like I said, there's no identifiable underlying pathology. God, I know, for primary dysmenorrhea. However, there are postulations. There's a chemical in the blood of a woman called prostaglandin. Prostaglandin tends to be high during menses because it helps the uterus to contract. It's like the contraction chemical that helps the uterus to contract to release all that blood from your body. Okay? Now, women that have primary dysmenorrhea tend to have higher than expected levels of prostaglandin. So it's just firing at the uterus at every possible time, causing the uterus to just be cramping and cramping and cramping, and then you have that pain. Or sometimes she has normal levels of prostaglandin, okay? However, our uterus is just overly excited by the presence of this prostaglandins. We call it hyperexcitability of the uterus, and then we just little amount of prostaglandin everywhere, not scatter. Okay, so and then she just starts to have this serious pain. Okay, so that is primary dysmenorrhea for you. It's just a chemical uterus thing, not really that she has a problem in the pelvis. However, secondary menstrual pain, there is a problem, and the problem is usually one of these four things. One, fibroid. One of them is fibroid. Another one is called endometriosis. Endometriosis simply means some part of the uterus is outside of the uterus. It's not where it's supposed to be. That's a topic for another video. We'll discuss it later on. Then there's adenomyosis. Adenomyosis is a very related problem. It's a problem that's just very much like endometriosis that we're going to talk about in another video entirely. And sometimes we have pelvic inflammatory disease. Pelvic inflammatory disease is more of the remnant of an STI. So when people get gonorrhea or chlamydia and it is not properly treated, and then the infection just stays there, and then they continue their daily life, they continue doing their things, but the infection eventually causes this uterus to become stuck with the intestine, and all those other structures become stuck with each other, and then whenever she has a period, she has a serious pain, and that is what PID is. That is the simplified version for you to be able to understand it. So those are the causes of secondary dysmenorrhea. Now, what are the tests that we do to confirm? Again, primary dysmenorrhea, like I said, when you go to your doctor's office, your doctor knows your age, asks for the symptoms, asks for how it presents and everything. It starts to build up a picture. If you believe that it's primary dysmenorrhea, like I said, there's no identifiable pathology, so there's no test that will do. But if your doctor thinks, okay, this may be secondary dysmenorrhea, what he will do is he will now start to order some tests. If he thinks it's a fibroid, he will tell you to do an abdominal ultrasound. If he thinks that there's something in your abdomen, he will tell you to do what we call a laparoscopy. A laparoscopy is like a camera put into your abdomen to look at your abdominal structures and your pelvic structures to make sure everything is fine. Okay, we also do an hysteroscopy, which is basically a camera put into your uterus to view the uterus and to make sure that the structure and the anatomy and the architecture and all the chores are fine. Okay, so that is that about testing. Okay, now treatment for secondary dysmenorrhea is very straightforward. We know that there's an underlying problem. Go there and remove the problem. It may require surgery, it may require drugs, whatever is needed, the doctor will handle it. For primary dysmenorrhea, however, the treatment may be conservative. Conservative meaning that you don't need to use drugs. If you have mild pain, you may not need to use drugs and abuse medications. So if the pain is just mild, all you need may just be a warm bath, okay, whenever you have the period pain, and it will help. A warm bath, just use warm water to bath and it will get better. Or you can pour some warm water in a bottle, okay, or in a plastic, and then put it over your abdomen, and then it will get better. Warmth tends to reduce the pain. That's the whole concept. You want to apply warmth on your body and your abdomen, and then the pain will reduce, okay. However, if the pain is moderate or moderately severe-ish, you may need to use medications. And the holy grail of medications that we use for treatment of menstrual pain are called non-steroidal anti-inflammatory drugs. We call them NSAIDs, non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, examples include diclofenac, ibuprofen, mefenamic acid, and all these drugs that are available over the counter in Nigeria. Now, you find out that a lot of patients use these drugs, Pelvin and stuff, they use them almost all the time, and they still feel pain from month to month. It's because you don't get proper advice on how to use it. There's a way you use these drugs that's going to work for you. So if you know your period is going to start on the 7th, you start using the drug on the 6th, okay? So you start using the drug a day before, that's one. Then you use it regularly till your menses finishes, to the end of your menses. So your menses is going to last for 4 days. You use it for 4 days. So use it regularly, not on and off, not when you feel the pain. So you take 50 milligrams, you start the drug a day before your menses, 50 milligrams diclofenac in the morning, 50 milligrams in the afternoon, in the evening, and then day one of your menses, 50 milligrams in the morning, 50 milligrams in the evening, like that, till the menses ends. You use it regularly. That's one. Two, if you're eating a particular dose of the medication and it is not working, you may need to up the dose to a maximum daily dose. This is where your doctor comes in, because you don't know the maximum daily dose of the drug. The doctor will come in to tell you what the maximum daily dose is. Another thing is, sometimes you use NSAIDs and it's not enough. You may need to combine it with paracetamol and use it regularly too throughout the course of that menses or menstrual pain. Now, keynote: if you have ulcer or you have asthma, you cannot use diclofenac or any of these NSAIDs, because NSAIDs tend to make your ulcer worse, while they also tend to trigger an acute asthmatic attack. So don't give yourself unnecessary headache. If you fall into any of those categories, I'm sorry, the only drug that's available for you will be paracetamol. If the paracetamol is not working, then you see your doctor, and your doctor will be able to judge if it's worth stepping up in the pain ladder management into other drugs, which include opioids like codeine and morphine and whatever. But most likely, if you need that kind of medication, you're most likely deal with secondary dysmenorrhea. Okay, so with that being said, we have come to the end of this video. I hope you enjoyed it. I hope you learned a thing or two. I enjoy putting out there. I hope you enjoy it as much as I enjoy teaching. I'll see you guys in the next video. I'll put a link down in the description for my video on fibroids, so you can learn a thing or two. And then in future videos, I'll be discussing some of the other concepts that we talked about in today's video. Don't forget to like, share, subscribe, and I'll see you guys next time.